I'd like to introduce the moderator of our first panel, which is called Looking at the Big Picture, Establishing Climate Urgency. And that person, this is her third year at the Climate Innovation Summit, Michelle Carr, is the CEO of Evergreen Climate Innovations. Formerly known as the Clean Energy Trust, Evergreen Climate Innovations has catalyzed $500 million and growing in follow-on funding to support its growing portfolio of climate-focused companies, and she's been a great leader in this space, and we're delighted to have her here once again. So please welcome, to lead our first panel, Michelle Carr. Michelle.
Hello. All right. Well, I'm thrilled to be here. I'm Michelle Carr, and I lead Evergreen Climate Innovations. For those of you who don't know Evergreen, we're a not-for-profit, and we help early-stage climate tech companies and entrepreneurs make their businesses into businesses so that they can provide impact at scale. And before that, I spent 11 years at the Nature Conservancy, and in full disclosure, Georgie Geraghty, who's up here, is my former colleague, and I look forward to being with her. I'm going to start us, before we get into our conversation. So first of all, what we're going to talk about here is nourishing common ground on climate urgency. How do we establish the urgency and then also find that commonness? The simple idea when I started playing with, like, where do we find commonality? And I'm so inspired by what Harry just had to say. I know, and I think we all know, that nature is a commonality that we all share. We often talk about nature as over there, someplace we go on the weekend, the forest that I'll be bathing in a couple weeks. But we are all nature, whether it's the wild gut biota that is going on inside us, or the air we breathe, or the water we drink, or the temperature outside on a July day. And when it shifts, we all feel it. And it hits close to home. It's personal, it's proximal. And that is a shared value of everyone, no matter what way you vote. And so there is a thread there about finding commonality. So what I would say is, as we think about environmental issues and how they often get tangled up in controversy or this side or that side, there is a personal proximal thread that is real and that research shows is a way that we can find common ground. And so today I'm just thrilled. I have 4 people who are absolute experts on this sort of common ground and terrific messengers. And so I'm going to start welcoming them to the stage. First, allow me to introduce Michael Davidson. He's the CEO of Openlands. If you could come up, Michael. Okay. Yeah, I think that's it. We have Dr. Laura Zimmermann. Laura is the Division Chief of General Internal Medicine with Rush University Medical Center. We have Dr. Don Wuebbles, Harry E. Preble Emeritus Professor of Atmospheric Science at the University of Illinois. And we have Georgie Geraghty, Executive Director, the Nature Conservancy in Illinois. Okay, welcome everyone. So why don't we just get ourselves warmed up to talk to this fine crowd? I'd like each of you to spend a minute or so on who you are and why this matters from your seat. And maybe we could start with you, Michael.
Hi, Michelle. It's great to be here. Mike Davidson, President and CEO of Openlands. Openlands, founded in 1963. Interestingly, we did not come out of the environmental movement. Openlands was founded by what is today the United Way of Metropolitan Chicago. Back then it was the Welfare Society of Metropolitan Chicago. So it was the social welfare movement, in many ways the health movement of the time, that recognized the need for land in this region. So we've been around since 1963. We've done incredible things, largely due to the brilliant staff at Openlands, several of whom are here today. 2 things come to mind, Michelle. Our tagline, Openlands, Conserving Nature for Life. It's a great brand. It is what you kind of opened with. We are, and I know this is sort of esoteric, but we are products of nature. You know, when you're stressed out, you know, what do? Like when you're freaking out, like you had a really bad day, you're troubled about something, you go for a walk. That's nature. You go to the beach or you watch a show that is about nature. That is nature. So, you know, our drugs come from the jungles. You know, we design airplanes based on how birds move. So there's so much about nature that we've learned from, and we have got to move beyond this kind of era of dominion over. So that's the more esoteric response to the question, but I think I've got something a little more practical. Nature, and this is a policy thing, Openlands works on a lot of policy. Nature does not have a voice. It doesn't have a voice at City Hall, doesn't have a voice in Springfield, it doesn't have a voice in Washington, D.C. Who speaks for the plants and animals who are lost to habitat destruction? And I hope we can touch on the Endangered Species Act at some point today. So that's my opener.
Yeah, hi, I'm Laura Zimmermann. I'm really honored to be here. I am a primary care internist. I have additional training in preventive medicine and lifestyle medicine. I'm the division chief of general internal medicine at Rush University Medical Center. I'm also the senior medical director for our clinically integrated network. So I work on quality and payer contracting as well. I am here today primarily as the primary care provider. You know, my commitment, Rush's commitment to environmental sustainability are directly tied to our commitment to improving health outcomes in the communities that we serve, right? We can't have healthy patients without a healthy planet. Climate change and our own interactions with the natural environment, the environmental impact of our built environment are what we call in medicine social and structural determinants of health. And over the last 2 decades, the healthcare system, the healthcare professions, generally speaking, have started to pay a lot more attention to these social and structural drivers, of which climate change is one. We at Rush have an anchor mission. We are actively addressing these social and structural drivers to advance the health of the communities that we serve. In particular, we are trying to mitigate the life expectancy gap that exists between the loop and many of the zip codes and the communities that we serve. Someone living in the loop can live 20 years longer, typically, than someone living in West Garfield Park, just miles down the blue line. So we are actively addressing the social and structural elements that add to that gap. And our efforts around climate change, environmental sustainability are a key part of that. We would be remiss as healthcare professionals to not acknowledge our part in climate change and environmental sustainability. The healthcare sector is actually responsible for 10% of greenhouse gases produced. We know at Rush that this is largely, actually this is not unique to Rush, this is all health systems. It's largely driven by supply chain at this point. All that it takes to manufacture the goods, the services, the energy that we purchase, and then all of the disposal and whatnot that has to happen down the line to maintain things like sterile technique, universal precautions. Those of you in healthcare know how critical that is to good outcomes for our patients. We are also, I would say, seeing an urgency right now in terms of healthcare's contribution to climate change, because we are, like other sectors, rapidly incorporating AI into almost everything that we do, right? So soon, many anticipate that we will be having discussions less about the sustainability of our supply chains, or maybe in addition to those discussions, but more about how we are contributing to sustainable energy, the demand for energy, and what is happening around the data centers that we are creating demand for. So very excited to be here today. I also want to give a shout out because Ian Hughes is our Director of Environmental Sustainability, and he runs the Office for Sustainability at Rush. He and a couple members of his team are here today. So looking forward to the discussion.
Hey. Thanks, Michelle. I'm Don Wuebbles. I'm a as you heard, I'm emeritus professor at the University of Illinois. I'm also part of a company called Earth Knowledge. I'm director of climate science for that. So emeritus professor means I'm supposed to be retired. I'm totally failing that. Why? Because I work on one of the most important issues facing humanity. I can't help myself. I got to keep doing this. Climate change is, we've seen nothing yet compared to what we will see over the next 50, 100 years. And yet it's accelerating at a rate that's faster than I, as a scientist, and others, all my fellow scientists working on climate change, expected. And so it says we're still underestimating the science in terms of its impact. And so I spend most of my time trying to understand how humans affect our planet in various ways, but part of that being on climate change. And that's one of the big issues in terms of how we look at solutions, both mitigation and adaptation for climate change, is because we have to consider that this really is due to us. As they said in Pogo, we found the enemy and it is us. And you have to accept that to realize what the politics of the solutions need to be, which is where we need the politics. And unfortunately, we're in this situation where politically it is denied. I'm been FOIA'd many times this year just because it's an harassment of the science community that's ongoing. And this continues. You'll be hearing something really major about a report coming out in the next few weeks from the National Academy of Sciences, where there's going to be a strong backlash to that. And why? Because it's going to say that we know how to analyze the climate change that is associated with human activities relative to that from nature. These changes we're seeing are not due to nature. They are due to human activities. The changes occurring are 10 times faster occurring than nature tends to change the climate. So we have a clear understanding of what's going on, and I feel my big effort is to try to help people to understand that.
Well, hello, everyone. It's great to be here today, and thank you for coming. Because this is exactly what we should be doing, talking. More of that to come. As you heard, my name is Georgie Geraghty. I am the Executive Director of the Nature Conservancy in Illinois. The Nature Conservancy is a science-based organization. We operate in 83 countries and territories. We started as a grassroots organization. In fact, Rachel Carson was one of our founders. We now have 6,000 people working across the globe. And Michelle asked, why does this matter? And I can answer that professionally and personally. Professionally, the mission of the Nature Conservancy is to protect the lands and waters upon which all life depends. You can't do that unless you address climate change. And keep in mind, life is us. Personally, climate change affects everything I love. It affects my family, my children. I think about this a lot. And it affects the places I love.
Well, thank you all. And let's start off. So this conversation really is about the messengers and finding common ground. And we're going to dig into that. But first, I want, Don, for you to talk a little bit about a study you led. It's called the Illinois Climate Change Assessment. Tell us what is happening now in Illinois and why common ground comes from being very space-based.
Yeah, so some years ago, I think when Michelle was still the director of the Nature Conservancy and I serve on the Board of Trustees, I suggested that there's a real need for an assessment of the impacts of climate change on the state of Illinois, and because there had been no state assessment. And so TNC said, go ahead. And so I got organized about 20 scientists and other experts across Illinois and few from elsewhere to work with me, and we produced a report in 2021, so it's 5 years old now. But if I update that and say, okay, what's going on now? Back then we said, the state of Illinois has seen, like 1.1 degree Fahrenheit change in temperature. And now, going through 2025, we not only see that is more like 2 degrees, whereas the global average, by the way, the global average change is, and that's annually and state average, but annually and globally average is right now about 1.44 degrees through centigrade. So it's about 2.5 degrees Fahrenheit. This year, or over the next few years, we will pass 1.5 degrees, which was the goal of the Paris Agreement, to kind of keep us below 1.5 degrees centigrade. So that's not going to happen. The problem with that is that's also going to set off various tipping points with irreversible changes in our planet that are likely going to be very difficult on generations to come. Going back to Illinois. So we're increasing rapidly as well. But we've been increasing mostly at nighttime in terms of temperature, not as much the daytime. And that's related to changes in weather patterns, the fact that a warmer atmosphere makes more water vapor available in the atmosphere, more evaporation. That's led to large precipitation events in Illinois. We've seen about 12% or so annual increase in precipitation in the state of Illinois. That's going to continue. More of that coming as large events, and also tending to have strong seasonal behaviors. We're tending to see a lot of that increase happening in winter and spring months. Summer's still having an increase in overall precipitation with very big events like we've been seeing recently, but also more days in between with no rainfall, this week being one of them. I don't think there's going to expect any rain till the potential the weekend. And so that means mini droughts, more opportunity for flooding, more heat waves. We've already been seeing more heat waves this year. The surprising thing to us as scientists was that we're also seeing a huge increase in the number of large energetic storms producing tornadoes. Illinois has had almost 80 or so more tornadoes than any other state in the union this year. Those numbers are still being sorted out. It could be as much as 100 more than any other state. Why is that? The tornado alley, at least for the time being, has shifted eastward, and we're facing the brunt of it. Luckily, we have not seen huge amounts of damage in the state. They've been relatively small tornadoes by and large, but we're seeing more energy in the Earth's system, more significant storms. So these changes in rainfall, heat waves, large heat wave type events, flooding, droughts, those are where the real damage to humans and to infrastructure and to life on our planet, the wildlife, really are affected. And those things are happening right here in Illinois.
Thank you, Don. And I think, what is established is that climate change certainly is here and now. We're seeing these more extreme storms. We're seeing much more variability. We're seeing more stress on our built environment and on the human and biodiversity and environment. Now, when you look at the research of messengers, and there's a really good body of research. The Yale School of Climate Communications, if anybody wants to wonk out on it, it has a lot of really good stuff. And there's consensus that scientists and doctors, people you know, people like you, those are the people that you trust, and scientists and doctors rank up at the top. And Laura, I'm looking at you. Don has, with his colleagues, led this Illinois climate assessment to be that voice of facts for the proximal area, making it close. That's another thing that one must do, making it real, making it tangible. Laura, there's not much more tangible than sitting in a doctor's office in a gown. Can you talk a little bit about what it means to be a climate messenger and some of what, how from a health and prevention framework, you're thinking about climate change?
Yeah, no, absolutely. As a messenger, I would say, I don't meet a lot of resistance, but I think it's because I'm interacting a lot with people who are directly affected by climate change, and they buy it. It's their lived experience. And I think that we are lucky to work at an organization where our executive leadership and our board understands that as well. I will say that, we see the effects of climate change and of, environmental changes, suboptimal conditions all the time in medicine. Today I can tell you my waiting room is probably full. It's probably packed because of the air quality alert and the respiratory symptoms that people are facing, and also because a lot of patients, a lot of individuals, a lot of communities in Chicago, right, we're talking about an old real estate stock, right, where the buildings are not equipped, they're not able to be optimized in this kind of extreme weather, right? Whether it's cold or whether it's warm. And so a lot of our patients, if they have an appointment with me in the morning, they stay with us in the waiting room all morning because the conditions in our clinic are so much better than their conditions at home. We see, particularly it was dramatic when wildfire smoke overtakes Chicago, right? We get more calls about respiratory distress. We get more requests for albuterol inhaler refills. We have more people coming in for visits. The people who are scheduled anyway, this is another, right? Maybe they're coming in for their annual physical or their new knee pain or their, diabetes checkup, but now we're also talking about their respiratory symptoms as well. The other way that I see this manifest is, of course, if you're looking at a more of a population health perspective, there are a number of studies that have been done, and there are a number of data being collected on things like pollution and exposure across the city, things like real experienced on-the-ground temperatures in the city. And of course, as is the case for so many things in our city, these show up in greater proportion and greater intensity on the west and south sides of the city. And if you overlay those data maps on economic deprivation indices, if you overlay it on cancer mortality, cardiovascular mortality, it's all the same map. So it gets back to how we are experiencing climate change and environment changes in medicine and how it's so important to address these as structural and social determinants of health.
Just quickly, Michelle, incidentally, on the train ride over here, I took the Green Line from the office. My Aunt Kate, my parents were born and raised in the Upper Peninsula of Michigan, and I still have family up there. And my Aunt Kate, with whom I'm very close, texted me a photo that was taken probably now 2 hours ago of my Uncle John out on the property with a mask on. And you can barely see the edge of their property because there are so many wildfires in the boundary waters of Minnesota. And they've sort of, the smoke has come over into the Upper Peninsula of Michigan, and they're worried. My Uncle John doesn't feel well, and then you add to it, forests that aren't managed properly. And they have had no rain for months, no substantive rain. And that's a lot of forested land up there. And it's a tinderbox.
So we're seeing climate change here and now. It's affecting us all. Georgie, I'm aware the Nature Conservancy has done a lot of work on thinking about messengers and how you find people outside of the tent, if you will, to be in the conversation about what's happening here and now. Can you talk a little about what you've seen?
Yes. So I feel a little sheepish sitting next to Don on this, but one of the things that we've seen is an erosion of trust in science. And that's a tough one. As a science-based organization, I mean, almost a fifth of our employees around the world are scientists, and to say that maybe they're not so trusted it's been a bit of a wake-up call, and we have had to think very deliberately about messaging. Farmers like to hear from fellow farmers. There's a lot of trust in park rangers. We've done polling that has shown kind of who people trust, and so, this may come as a surprise, but I want to say that corporations can be very powerful messengers. And it's for a couple of different reasons. First of all, think about the audience that a corporation can reach. Their suppliers, influencing through procurement supply chains, their customers, their investors, and their employees. Corporations also tend to lead by example, just doing things. And there are some really terrific examples here in Illinois. Rivian manufactures their trucks down in Normal, Illinois. You've probably seen them around Chicago. What you may not know is that Rivian has been very concerned about the source of their energy to power that plant, that manufacturing plant. And they wanted to be industry leaders. They worked with the Nature Conservancy to put together an RFP for a power purchase agreement. In the end, after a very robust process where they looked at not just climate impacts, but community impacts and conservation impacts, they decided to purchase their power from a solar installation that was going to be built or is being built on an old coal mine in Kentucky, the Starfire plant. What Rivian has done that's actually really wonderful is they have written a white paper about this, and they have gone around the country. They've presented at New York Climate Week and in other venues because they want other corporations to follow their lead. Another great example is BMO. BMO is one of the 5 largest banks in Canada. Their U.S. headquarters are here in Chicago. They are a leader when it comes to climate change. It is not narrowly addressed through their sustainability enterprise, but it's throughout the entire company. They provide technical assistance to their suppliers so they can make changes. It's not just a mandate. They have a net zero branch. BMO Talk, they have a podcast where they talk about climate change and engage their employees. Their leadership likes to say that progress is what is important, not perfection, but they have embodied climate change as part of their mission. And when you have a financial services company talking about climate change in terms of business opportunity, risk management, and community investment, it's a very powerful voice indeed.
That's great. So we have a corporate voice can be a force for good. I know they aren't always a force for good. I want to take it back to sort of how we intersect with our green spaces and the health. And I'm looking to you, Laura. You lead a prevention-focused practice, and I think about how people, clinicians might ask patients to get out and move more, to manage stress every day, to do things that might involve interacting with nature. Can you talk a little bit about, so people walk into the room, how much is already like baked in? I mean, people are as healthy as they come to you, but how much can parks and air quality and is that a determinant? I didn't ask that very well, but I think you know where I'm going. It's like, talk
Absolutely.
Please about that.
Yeah, no worries. Yeah, no, that's a great question. It was perfectly worded, but we know that only 20% of a person's health is actually determined by the health care that they receive. The other 80% is determined by factors like genome, right? Genetics, It's determined by behaviors. It's also very much determined by our environment, the built environment, exposures, exposure to stress, et cetera. And when you think about it, those are not mutually exclusive elements that are making up that other 80%, right? The behaviors are determined by the built environment. They're determined by the exposure. And there is a burgeoning, there's a rapidly expanding scientific literature around how our exposures and our environment actually affect the way our genes are expressed, right? So the environment is not going to change your genome, but it will absolutely change the way that your cells and your body express the genes that you have. And so when you think about it, the genomic element to your health, the behavioral element to your health, and then the built and other environment are really all interconnected. And yet another reason why we need to be paying attention to climate.
So I want to bring Mike into this, Michael. So should the places that people are expected to do things, and anyone's voice here, should those be included in the clinical conversation about health? Get outside, but if someone is in a neighborhood that doesn't have access, it's a pretty tough order.
Is that question to me, Michelle? I think the answer is yes. And we have doctors like Dr. Zimmermann that know how to speak the language. It agreed with everything you said, Dr. Zimmermann. But we haven't designed communities to do this. Particularly communities where there's a lot of urban disinvestment. Where are the nearest parks? Are there sidewalks? You go to a lot of communities in the suburban areas or in rural areas, there are no sidewalks. And if there are parks, what condition are those parks in? There are parks that are ugly, and you're not going to want to hang out there, or dangerous. You're not going to want to hang out there. It's very different than a park that's been restored or activated in a beautiful way. And so I think what's really important, and this gets to urgency, in a country like this, where you have a federal government that right now is not a partner on these issues, the good news is that this country was designed for state and local action. So we are not hopeless. That's what happens in a federalist society. The power is handed down to the states, and most states hand that power down to municipalities, particularly in a state like Illinois, where there's very little, even though there's a lot of bluster coming out of Springfield, you'd think that it has tons of power. Most of the power is with local governments. This is a home rule state. So the city of Chicago, municipalities have enormous amounts of power, and that includes planning and zoning power. They get to decide, and it's not always easy, but they get to decide how the community is designed, what it looks like. And they don't get a lot of incentives from the state to do that well, but we do need to hold our local governments accountable, whether it's the county, and I've got two examples. Can I bring two examples into this? I'll give a good example and a bad example. Let's start with the bad example. Both have health implications. And so, did any of you read a couple weeks ago, there was a New York Times article about, let me call it the supply chain sector. So these are intermodals, warehouses, maybe data centers, but did you read that New York Times article about how this new sector in real estate development is just, obviously it's taking the country by storm. This region is an epicenter for this kind of development. So you go through a part of the region with a lot of intermodals, you cannot not know that you are you're not surrounded by intermodals. Well, Will County, southwest part of the region, is one of those places where intermodal development, supply chain sector growth has really taken over. This is also part of the region that has historically done no water. The groundwater, they've been studying this for decades, and the southwest part of the region has been drying up for years, in part because of unchecked development. And remember, that development is the result of local decision-making, municipal decision-making. They've said yes to too many developments. So they deplete their groundwater aquifer, and then they decide to tax themselves, which they've all, a cluster of southwest suburban municipalities are going to now tax themselves billions, literally billions, to pipe in Lake Michigan water. So this is done. This is going to happen. Pipeline hasn't been built yet, but it's going to be built. I can't remember how many billions of dollars it's going to cost. So they're running out of water. They're running out of water so much that they're going to tax themselves to build a pipeline to ship Lake Michigan water 55 miles to the southwest suburbs because their aquifer is drying up. And yet they keep saying yes to these projects. When all of the municipal plans, i.e. community residents who participate in the planning process, say, we don't want that. We want more open space. And so that New York Times article covers the health implications of all of this stuff. Everything from car accidents, kids being hit by bikes, by 18-wheelers when they're on their bikes, to emissions. There's all kinds of health implications, the water issues. That, bad government. And we need to hold our local planning and elected officials accountable to the plans that they put out there. Those are plans that we participate in. They're our plans. And we need to make sure they're implemented. Good story. Years ago, before I came to Openlands, I spent many years in philanthropy at the Chicago Community Trust, and when I first arrived there, working with my colleague, Renee Michaels. Renee, raise your hand, at the Community Trust. She was with a different foundation, but we partnered on this. We were asked to fund the very first comprehensive plan for the Cook County Forest Preserves. So that is the very first forest preserves in the country, Cook County, ours here, and it's the largest still. And they created the first comprehensive plan for themselves in 100 years. It's called the Next Century Conservation Plan. The reason why they created that plan is because they were under new leadership, Arnold Randall, and they were coming out of years of distrust because the forest preserves had become a literal and political dumping ground. And their reputation was just in the toilet. Well, Toni Preckwinkle said, we've had enough of this. She hired Arnold Randall. He began to pull that agency out of the abyss. And the first thing that he did, he says, we need a plan. This is the country's first. It's the biggest. We need a plan. And so it was more than a government exercise. It became a civic exercise, and Renee and I were asked to fund it. And it was not cheap. It was something like $500,000 or $600,000. We said yes to it. You know who the chair of that planning process was? Eric Whitaker, the doctor, an MD. An MD chaired that planning process. And what the residents of Cook County got was a stellar document that Arnold and his team didn't shelf. They actually used it. They even changed the way Cook County Forest Preserves funds itself based on the goals and the objectives of that plan. So this is an agency that did a plan, and they followed it. And this is now a reputable agency, and I could go on and on about all the amazing work that the Cook County Forest Preserves have done, but it is because of good planning, being held accountable to that good planning, good leadership at the agency, and that leadership being held accountable. And now we have the forest preserves, which are in many ways doing an excellent job for all of us that live in Cook County. So 2 examples of municipal decision-making, a bad situation in the southwest suburbs to be determined on how that plays out, and a good situation here in Cook County with the Next Century Conservation Plan.
Thank you, Michael. And I think just pulling on that thread of protecting nature for human health, Georgie, in our prep, you brought up a really good example about a study about trees and what they do for human health. And I know this is Laura's expertise, but there was one by the Nature Conservancy.
Yes, in fact, I'm sure Laura knows about this. Back in 2017, the National Institutes for Environmental Health and Sciences funded a study that involved the University of Louisville, a number of community organizations, and the Nature Conservancy. And the question that they wanted to test is, if you have a longitudinal study, can you prove that planting trees has a demonstrative benefit on health? Because there's a lot of, until that time, discussion and thought that there's a correlation of mental and physical health benefit. But can you create a study? And they did. It involved setting aside or identifying 4 neighborhoods in Louisville, Kentucky, and planting 8,000 trees. The interesting thing is they largely planted evergreens and shrubs because they are more inclined to absorb air pollution, and they planted really big trees. I mean, if you look at some of the video, it's extraordinary. Some of these mature trees, they were brought in because mature trees obviously are going to have a greater impact than new trees. They also enrolled 745 individuals who agreed to go through a battery of tests every year. This study went on for 7 years. And at the end of that study, and it is still ongoing, they were able to document a 20% reduction in inflammatory markers, which are tied to cancer, heart disease, and other impacts. And for a science-based organization, that really propelled the Nature Conservancy to think not just about health as a co-benefit, but something that we should be driving toward as a prime part of our mission.
Thank you. And I want to pull back just like, let's keep channeling this common ground. When there are things that everyone holds true, and I love the way Harry framed it. It's like everybody wants to breathe clean air. We all depend on clean drinking water. We all can't stand temperatures above X in certain conditions without air conditioning. We see our beloved trees getting knocked down in these extreme storms. And even worse, we see neighborhoods devastated by destruction in these ways. People feel it. And so making this connection between climate and one's own personal, it has to be made proximal. You keep using that word. One of the ways we do it is by talking to our doctor, trusting our scientist that is at the local university. It is also by community-led efforts. And so I want to look to you, Michael, and I'd love for you to talk about what it means to put community at the center of nature efforts, of climate resilient efforts, and why you don't just go in and say, oh, I know exactly the plan you need to do.
Right. Before I do that, Jill Koski, I see you. So speaking of trees, we've got the president and CEO of Morton Arboretum in the house today. Glad you're here, Jill. Nobody knows trees better. I think the answer to the question, how do you engage community? I think it's the job of nonprofits like Openlands. I don't want to speak for all nonprofits. Some nonprofits are direct service. That's not what Openlands does. But an organization like Openlands, which is established, credible, a powerful platform, privileged, it is our job to build the scaffolding that then allows communities to plug in, to do their thing, to bring their ideas, to move something forward. That is the role of a regional organization like Openlands. So we partner all the time with hyper-local, place-based neighborhood organizations, for example, here in the city. And our kind of scaffolding that we are able to build up here then gets applied on the ground down here. So that's sort of what I'm thinking generally. I know that's very conceptual, but I think I'm seeing nodding heads, so I don't think I'm losing you. Two examples that come to mind, and the first is trees. I mean, Openlands has this beloved program called Tree Keepers. Any tree keepers here? There's got to be at least one. Openlanders. It was started by Suzanne Malik McKenna, who many of you might know, 1990, Daniela, decades ago. And it's about the urban tree canopy. Trees are a portal to nature. Some people don't know what nature is or how to access it or what it's too obscure. Well, that tree outside your apartment window on the parkway, that public tree, that's for many of us that grew up in urban environments, that is our first experience with nature. We love it. We like the shape of it. We like how it moves in the wind. It loses its leaves in the wintertime. We watch the birds during migration season. It's fascinating. And so what Tree Keepers does is it trains. We offer the classes, 3 of them a year. 1 is in Spanish. And we train everyday Chicagoans, everyone from the First Lady of Chicago, who became a certified tree keeper with me and my husband, Christopher, to, Joe Schmo, who just is a neighborhood guy and just wants to get involved in trees. We train them to prune trees and learn about trees and understand trees in a city context, mulch trees, take care of trees, then they become certified. And they are allowed to partner with the city of Chicago and work on trees in their neighborhoods. And then they organize locally. They go back to their wards, and we equip them to do this. They form their own kind of chapters. And now there's 2,500 certified tree keepers across the city, mostly the city, but some nearby suburbs. And they take it on themselves. They become kind of mini like Openlands in their neighborhoods, and they do tree inventories, and they monitor their trees. And when we need to push a tree policy at City Hall, they are our army of supporters. It's those tree keepers. So that's one way to build the scaffolding that activates local folks, and then they actually carry the work forward. I have one more example, but
I want to get one from Laura. I love that example, but there's a lot going on in community-based partnering with healthcare that is a great bridge builder.
Yes, thank you. Some in this room, because the partnerships are wide and involve many stakeholders across the city, but some may be familiar with the recent opening of the Sankofa Wellness Village in West Garfield Park. And credit to Ian Hughes for helping to integrate our sustainability pillars and strategy into our anchor mission strategy when it comes to opening up that facility. Rush has an anchor strategy in which we are investing, hiring, purchasing, and volunteering locally in the zip codes of the communities that we serve as a means of closing wage gaps and also building wealth within those communities. And Ian and team have been instrumental in pairing with our BMO Health Equity Institute to instill the sustainability principles and strategies that we're pursuing in those community-led efforts that are already happening. So the West Side Right to Wellness was the main organization involved in Sankofa Wellness Village. We partnered and supported. YMCA is involved, West Side United is involved, and it's a great example of where we were going to do this already, right? But there were opportunities to infuse the effort with our sustainability strategies. So there is a green rooftop, there's a rooftop garden. The foods that are being purchased as part of the food insecurity program there, the healthy plate, the different initiatives that we have there to address food insecurity, those foods being purchased are sustainably farmed and procured, et cetera. So Ian and team have found ways, Rush has found ways to infuse these sustainability principles into some of the community engagement that's already happening. We also have an example where we help to procure the funding and investment for the Fillmore Linens facility in North Lawndale. And that opened up as a way to revitalize that community, again, bring wealth back into that community, provide jobs in that community. But it also actually ended up decreasing our carbon footprint substantially because now Rush University Medical Center is not sending 5 million pounds of laundry per year, 80 miles round trip to be washed. They are now transferring it 8 miles down the road. So it's another example of where we have community-led initiatives, community-centered initiatives, and Ian and team and others have been able to infuse sustainability pillars and principles into that.
And I love both of these examples because, and there are so many more examples that we talked about. The more it becomes normalized in your community that it is your right not to be living in a heat island, that it is your right to some of these benefits like a wellness center and a certain level of well-being. The more people see that nature and resiliency and climate are connected. So I want to move to playing a little bit with that. Former Tennessee Senator, Republican Senator Bill Frist, spent his career as a heart and lung surgeon. And he did that prior to elected office. He now chairs the Nature Conservancy's Global Board. You might have seen a really incredible article by him or of him in the New York Times just recently talking about his passion for addressing climate change and his care for healthier people. What does his path tell us about the language and messengers who create common ground? And I'll ask Georgie, because I know there's a lot of pride going on about that article right now.
Well, thank you, Michelle. The Nature Conservancy has always operated as a nonpartisan organization. We pride ourselves in finding common ground. We have state boards all across the United States, and we've made a really deliberate effort to ensure that we have broad political representation on those boards. But I want to go a little bit of a different direction here, because yes, we can talk about the politics and how to have red and blue representation and finding common grounds. And what we really seek to do, and I think what Senator Frist's article does, is take the politics out of climate. And how do you do that? I mean, that's the million-dollar question. And what we have found is you focus on solutions. You focus on solutions, practical, on-the-ground solutions, and you put together a coalition, a broad brush coalition, to advance them. Let me give you a great example. It's a great example because much of downstate Illinois is very, very conservative. And southern Illinois is especially conservative. They have a flooding problem, a very, very serious flooding problem. The increased rainfall that Don talked about has led to considerable flooding across the entire Mississippi basin. The infrastructure in place in Illinois and across our country is not suited to handle the increased rainfall, and levees are being breached week after week after week. There's an area in southern Illinois near Cairo. No, I'm not making a mistake. It is Cairo, not Cairo. That's called Dogtooth Bend. And there has been catastrophic flooding in this area for the past 10, 15 years. And in 2019, there was a particularly devastating flood. The levee was breached with such force that 6 barges were transported from the Mississippi River and ended up in farmers' fields. Now, keep in mind that this area has been farmed for well over 150 years. And suddenly these farmers found that they could no longer farm because instead of having soil, the scouring of the Mississippi River brought clay and sand and rendered their farms inarable. The Nature Conservancy worked with the U.S. Fish and Wildlife Service and partnered also with the U.S. Department of Agriculture. And this came about fundamentally by listening to the farmers. Farmers did not want to leave. They wanted to farm, and they had kept trying time and time again after flooding to put their business back on solid footing. But this devastating flood in 2019 was too much. In the end, we have kind of a three-part process whereby the U.S. Department of Agriculture through NRCS is putting easements on these, are paying the farmers to put an easement so the land is no longer used for farming. But then the farmer is left with the residual land. What are they going to do with it? Ducks Unlimited and the Nature Conservancy have been purchasing this land on a voluntary basis from farmers who have recognized that they can no longer farm. And we've been holding this land until the Fish and Wildlife Service receives appropriations or DuckStat money to put that land into a new and expanded national Fish and Wildlife Refuge. The wonderful thing about the refuge is it helps to address climate change because wetlands can help mitigate flooding, provides fabulous habitat for ducks, amphibians, and other wildlife, and a lot of recreational opportunities. And some of the farmers have relocated or been able to use their flooded land to grow pecans and cypress trees that have been transplanted to help with the restoration. But here's what we haven't talked about. We never have talked with these farmers about climate change. We've talked to them about their flooding problem, and work with them to find out how we can help. And I think that's how you get to that common ground.
Well, we're getting toward the end of our time, and I'm going to ask for a lightning round in a moment. But I want to go back to some of the threads here, and I am going to just say some words, and they happen to be the words that are well researched about what makes climate commonality, what makes those conversations. You make it personal. We heard that in the farmers. We hear it in health. We make it accessible. We make it empowering. We make it doable. We make it collective. We make it normal, trustworthy, and for everyone. And I'm going to end with an example before I ask for that lightning round. In 2022, Cook County put the forest preserves on a ballot initiative. 70%-ish voted yes in order to raise their taxes in a high-tax state because they saw the benefit of the nature around them. When you take the abstract out of it, when people think about my forest preserve, or they think about their neighborhood or what it's doing to their health, that's the key to finding the common ground. And with that, I want to end with asking, is there one concrete thing you wish folks in the room could do this month and tell us why it matters? Georgie, can I put you on the spot?
I'd say look up and out. And what do I mean by that? Look around. It's incredibly hot today. We've had no rain. Talk to your neighbor about that. You know, we have to observe what is happening and not pretend that it's normal. And we have to talk about it. And that's what I'd say. Look up and out and talk about it.
Well, that relates closely to what I was going to say, because I was going to say communicate. Probably the most important thing any of us can do, whether it's to those who represent us or just to your neighbor or to your family. Sir David King of the UK was the science advisor to 3 different prime ministers in recent decades in the UK. Sir David is a chemist from Cambridge University. Had led the chemistry department, which is where I first got to know him. And when he was science advisor, he stated, and at first it really kind of shook me because I couldn't believe it was really true, and now I know it's true, that climate change isn't just the biggest problem of our time. It may be the biggest problem of all time. And we have not faced what we're going to see in the coming decades and centuries. And I mean centuries. It's going to have a huge impact, not only on our children, our grandchildren, and their grandchildren, but those who come after. And we really have to take this seriously. So communicate.
I would say connect, collaborate, align. I'm probably preaching to the choir here, but I would say before leaving here today, make one connection with someone in another sector who's seeking the same outcome, whether it's sustainable supply chain, responsible use of AI, and sustainability of data centers. The more mutual priorities that we can collectively identify and the more incentive systems we can identify and align, the more it will be possible to do the right thing, the more success we're going to have improving the health of our planet and the health of our patients and honestly of each other.
Well, I might end this on a depressing note.
You're not allowed to.
Okay, it is about communicating and talking. The U.S. Department of the Interior just changed the rules on the Endangered Species Act. The definition of harm is now changed. Harm now means if you harm an animal on a site, that remains illegal, an endangered species. What is no longer illegal is removing the habitat that protects the animal. So they have substantially narrowed the definition of harm to the actual animal. Removing the habitat that keeps that animal alive or that animal needs for breeding or sustenance, that's no longer included in the definition of harm. So Openlands and others engaged in this conversation last year when they were changing the rules, and 220,000 others, 99% of which said, do not do that. They did it anyway. So my request is talk about this. Go on to Openlands, Google the media, tell your legislators, your elected officials that you do not like this. Land is absolutely a major part of the climate solution. Don't be fooled. And there is something urgent that you can do. It's not hopeless. This is a setback. We've had many. We will find a way to get through it.
Thank you. And I am very inspired by Harry Gottlieb, our first speaker, I have to say. And I knew a little before what he's up to, but I'm going to go back to my mother. I grew up in a rural community outside of Toledo, Ohio, surrounded by corn and soybeans. Let me tell you, she is conservative. And I will also say she would listen to that and say, that is BS. And I guess it goes back to the conversation. It goes back to what Harry has to say. Rational people, when you take out the triggers, they kind of get it, and they kind of have passion. Not kind of, they do. So keep it rational, keep talking, and keep finding common ground. And thank you for being with us for this panel.
Thank you.